Today we're going to discuss the Digital Intern as a real-time decision support tool. The Digital Intern provides value in healthcare by helping guide appropriate cost-effective medications to suit the individual patient's needs from the available formulary, limiting expensive alternatives when able. It can reduce unnecessary laboratory studies and time them when they are most effective at producing change, reducing blood products used, and improving response times to abnormal vital sign and laboratory values. In doing these things, the Digital Intern can reduce morbidity and mortality while simultaneously reducing costs and improving the quality of documentation. The Digital Intern interacts with all facets of the medical team, allowing providers to set targets for patients, communicate next moves with nursing and respiratory care staff, and controlling drug formulary options in a package that adapts to the individual patient's needs while standardizing the approach to patient care overall. Key tenets of the Digital Intern are that the providers are always in control of the targets and options available to the patients. Providers enter Digital Intern order sets for the Digital Intern to act upon, as the Digital Intern does not write its own orders. The order sets functions as a checklist, and parameters are set to meet specific patient needs, but defaults are available to use in common circumstances, with the Digital Intern working within the electronic medical record to minimize changes to workflow. Provider and allied health professionals continue to use and document in the electronic medical record as they would today. The medical record system will continue to collect data about patients from existing sources, which might include human data entry, interfaces with monitoring devices, and interfaces with the lab. The Digital Intern will reside on its own server behind the hospital's firewall. It will communicate via interface with the medical record system. When an order for blood is placed, this will trigger a call to the Digital Intern and send the necessary information about the order and the patient. The Digital Intern will respond with its recommendations, which will be available to the provider in the electronic medical record, appearing as if it were a part of the electronic medical record itself. As an example, UW began using a Digital Intern red blood cell algorithm. When they went live, there was a significant drop in red blood cell transfusions ordered as denoted with the blue line. The green line is what the Digital Intern recommended, and the values of the green line prior to the go-live date represent recommendations the system would have made had it been allowed to interact with the medical team. Note that physicians could bypass the recommendations, and this is reflected in the difference between the green and blue lines. In all, this resulted in a roughly $600,000 yearly cost savings that could approximate close to $900,000 had the recommendations been followed all the time. Dangerous infusions are a significant concern, but the Joint Commission does have specific requirements to better implement safe use of these drugs and concentrated electrolytes. iVMD has the ability to manage many of these infusions. Two examples are the insulin infusion module and the heparin infusion module. The blood sugar goals are completely adjustable within the defaults in place for most patients, and the heparin infusions and boluses are extremely detailed, covering things from pulmonary embolism to various ECMO circumstances to specific cath lab needs and the subsequent transition to the inpatient setting. The Digital Intern inherently addresses the use of different drugs that may overlap in the care of patients managing the concerns of therapeutic duplication. As an example, multiple vasoactive medications are often used concomitantly, and the Digital Intern can titrate not just to heart rate and blood pressure target ranges, but also to advanced cardiac monitoring parameters, all of which are configurable by the provider. Another common area of concern for therapeutic duplication is with pain and agitation. The Digital Intern can target CPOT and CNPI scores as well as RAS scores to achieve the optimal level of pain and agitation control using a combination of drugs needed to achieve the provider-defined goal. Hospital-acquired infections are a serious concern, and the Digital Intern is prepared to help healthcare organizations prevent ventilator-associated pneumonias and catheter-associated urinary tract infections by recommending best practices in a timely manner, because the little details often make the biggest differences. The Digital Intern library is quite robust and covers many aspects of ICU and general inpatient care, with the development of new outpatient algorithms already running. In addition, the Digital Intern records all decisions within the EMR. This can help with report writing and note writing as well. We are currently developing the Digital Intern distiller to use the stored decisions to help write SBAR and provider plans within a templated note. The output is structured by organ systems and can automate 80+% of note writing, easing the documentation burden on healthcare professionals. So let us help your organization realize your vision, mission, and values with the Digital Intern powered by iVMD.